I'm Barbara Mintzes, and I'm leading the Evidence Policy and Influence Collaborative that has attached ourselves on to the AIMOS conference and co-sponsoring. And it's my great pleasure not just to welcome Lisa Bero, but to welcome her back. Because in fact, she started EPIC and was working at Sydney Uni when I came. I came very much to work with her. So Lisa is an internationally recognized expert in evidence synthesis and meta research and on commercial determinants of health. And she has been a leader in terms of research on the tobacco industry and tobacco control policies, the pharmaceutical industry, which is how we've connected, and also big food and sugar sweetened beverages. So essentially looking at those commercial influences from a public health perspective. She's also a senior editor with the Cochrane collaboration on research integrity and has been working since 2020 at the University of Colorado as a professor in the Center of Bioethics and Humanities in the medical field. Yes, so thank you very much. Very pleased that you could be here.
And it's actually quite emotional being here. As Barbara said, I'm back, and it is just wonderful to see this group come together and to also see this intersection of commercial determinants of health topics and meta research topics. So that's actually what I was asked to speak about today. And I thought, well, too easy. That's what I've been doing for 30 years. But then I realized it's probably not quite an intuitive intersection to everybody. So I'm really hoping this will stimulate some thought into how we can also work together over the next few days on these topics. And I'm just so thrilled for the invitation and to be here again. Because of the nature of my work, I always show a disclosure slide. So I did have some funding for AIMOS, for which I'm very grateful for travel to this meeting. As Barbara mentioned, I'm a senior researcher with Cochrane, and the University of Colorado receives some funding for that. And I do consulting for governments, and I have grant funding and have had grant funding, because this is really going to cover my whole career's work from a lot of alphabet soup there. The main point is none of it is pharmaceutical, chemical, big food, or tobacco. I've never had any of those companies fund me. So this is how I frame why do I do this work? Why do a lot of meta researchers do this work? I think it's because we think evidence is important for health decisions. And the way I think about this is we've got an evidence base of trustworthy evidence. And if we have that, we can build systematic reviews, we can build guidelines, we can build health policies based on that evidence. And, there's a whole field looking at the translation of evidence into policy, but I think that's a fundamental belief that drives me, that evidence can influence health and health policy. And evidence, and you'll see this later, the way I conceptualize it, it's about how you design the question, how you design the study, how you conduct the study, and whether it gets published or not, or reported in some way. And so if any of those steps fall down, you weaken the evidence base. And the weakening of the evidence base that I've been very interested in over the years is related to what has more recently been termed commercial determinants of health. And I understand a lot of people aren't familiar with this term. There's a book called Commercial Determinants of Health. I would highly recommend it as a great introduction to the subject. We have one of the editors here, Mark Pettigrew, and I'm quoting from this book, the definition. So basically, activities of the private sector that affect the health of populations. As Barbara said, this takes a public health perspective. And so these direct effects, I think, are something we often think about. They're marketing of unhealthy products, lobbying of governments, campaign donations, taxes and duties that might affect products to make them more or less accessible to people. My focus has always been on commercial influence on research. And in this book, this is defined as funding unreliable or misleading research aimed at generating doubt about product harms. But I actually think that definition is a bit too narrow, and I have added to that or false claims of efficacy, because I like to think about harmful practices of industries that influence health, not necessarily harmful industries or industries that produce harmful products. And so please keep that in mind. I am talking about not necessarily a bad product like, tobacco or, heaven forbid, Coca-Cola. I'm talking about practices that promote harmful products in a way that can influence health. And again, focusing down, this is what I study. I study financial conflicts of interest in research. And you really find out about these usually in a couple of ways. I'm sure you all have seen this. This is a disclosure statement in a research paper, GLP-1 inhibitor study funded by Novo Nordisk, who makes the GLP-1 inhibitor. And basically that is funding for the research itself. But then we also have payments to researchers. So researchers may receive payments that are, and often you'll see that in a paper under a conflict of interest disclosure or a competing interest statement, something like that. And you'll see that a researcher might get payments from a company whose product they are studying in the study. We have actually historically a lot less information on these conflicts of interest. Historically, we had very little information on funding source, but that's actually gotten much better. So in people studying this, we have to look multiple ways to get information on payments to researchers. Barbara's having a workshop coming up, I can't remember, tomorrow, I think, looking at what are called open payments databases and how we use them. There's one in Australia, the Medicines Australia database. There's databases all over the world. There's the open database, it's called, in the US. And what this is, and you can go to the website and you can put in the name of a doctor and it will tell you which companies have paid that doctor in the last year and for what. This is probably the only time I will say the US does this better than anybody, the open payments database, because this database is mandatory. In all other countries, it's voluntary. So drug companies have to report these payments to doctors. Some of these doctors are researchers, and so that's how we can find out about undisclosed payments to researchers on papers. And is this a big deal? Well, I think so. In 2024, $3.3 billion US was paid by drug companies to physicians in the US. And that's just general payments. And so what that excludes is payments for doing a study, payments for clinical trials. It excludes that first column, which is direct funding of the study. So these are just personal payments to physicians. All right, so I think that's a big number. What do people who get these payments think? Well, this is what they think. I've done a lot of studies showing, actually interviewing researchers about their interactions with industry. And Eric Campbell, a colleague of mine in Colorado, has done a lot of surveys. He just actually repeated a survey that was done 20 years ago and found exactly the same thing, sadly. And this is what people say. I'm not influenced. My colleagues are influenced, but I'm not. I have ties with all the companies, so I'm not influenced by any. I'm doing the university a favor. That used to be my favorite. I chair a lot of these committees where I have to review these, and they would yell at me and say, I'm doing the university a favor. And then I recognize that I'm in conflict, but believe that I can handle it. If I couldn't handle the conflict, I would not have gotten involved. So lots of studies have been done where these same sentiments are found. But the sad thing, folks, is that the evidence tells us different. And this is where meta research comes in. All right, so when I'm talking about how we study this is what, as I said, I've been interested in, these financial conflicts of interest. But what so we basically want to find out, do these financial conflicts of interest bias the outcomes of research? And we know that a lot of things will bias the outcomes of research. We know, for example, that the methods used in a study can influence the outcomes of research. And we use meta research to study that. For example, Matt, we have right here, has looked at the effects of randomization or blinding in meta research studies. And we can see that inappropriate randomization or ineffective blinding will influence the outcomes of research to overestimate the effects of intervention. So we know that the methods used are associated with bias. We also know that, well, not everybody knows this, but that interest, values, and preferences can influence research. I mean, some people do argue that research is value-free, but let's not go there today. So there's a lot of things that influence research. And again, my focus has been, what about these financial, commercial influences? What evidence do we have that they influence research? So this is a definition. So basically, I wanted to study bias. And how do you study bias related to these commercial interests? And this is a definition from a Cochrane handbook. And I want to note, this is an older definition. I'll tell you what's changed. So Cochrane defines a bias as a systematic error or deviation from the truth in the results. The Cochrane handbook used to say, or inferences. Now the Cochrane handbook does not include that part. And there's a good reason for that, because as a systematic reviewer, we don't actually care about the inferences. We don't care about the conclusions of studies. We care about the data. We care about the results of the study. And so I can see why Cochrane took that out. But in terms of studying bias in research overall, we do care about the conclusions, because those are often picked up by the media, they're picked up by policymakers. So I think we want to give attention to both of those. The other point I want to make, and this is in the Cochrane handbook, is that a bias can over or underestimate a true intervention effect. It doesn't just go in one direction. You take a drug, this is really important, right? Because from the standpoint of health, it would be worse if studies of a drug overestimated the effect and underestimated the harm, right? So we're actually concerned about overestimation of effect, because then you'd wind up taking a drug that you don't even need to take or shouldn't be taking, and then underestimation of harm. So I want to talk a little about a very quick summary of some of the meta research that's been done that shows us what is the bias, like what is happening. So this is my depiction of all you guys and me. This is a meta researcher. He's a pug dog wearing a pug suit. So just like us, we study research, and he's a pug doing a pug thing. So this is what we do. It's not nearly as cute. We produce often meta-analyses. Of course, you can do meta research that doesn't wind up in a meta-analysis, but often we do meta-analysis to study bias. And so I think this is a really important point, because people in this room use meta-analysis to study bias. A lot of people just use meta-analysis to figure out a clinical effect, right? It's a different purpose for using meta-analysis. So let me walk you through this. This is a Cochrane review led by Andreas Lund. And we asked the question, do the results of drug studies differ by sponsor? And we looked at efficacy of the studies as an outcome, and we looked at efficacy of the drugs as an outcome and harm of the drugs as an outcome. So this is the meta-analysis on efficacy. So each one, this doesn't, does it? It does. Does it have a pointer? Yeah. Well, anyway, each bar here represents a meta-research study that looked at a number of studies in a particular drug topic and whether the funder was associated with the outcome. So some of those are looking at cardiac drugs, some of those are looking at antidepressants, some of them are looking at drugs mixed together. So each one of those is a meta-research study. And then we assessed all of those together. So what you see is that there's 25 of these meta-research studies that included almost 3,000 individual studies. And again, we compared drug industry sponsors to others. People always say, well, why don't you look at government? Well, we do look at government. That's the comparison group here, right? So we're comparing sponsors, and government and nonprofits are included as sponsors. And so studies with statistically significant results. So in our summary estimate, when we put all these together, studies with statistically significant efficacy results are about 30% higher among industry-sponsored studies than non-industry sponsored studies. So that's the bias we're demonstrating here. I'm not a big fan of statistical significance. People who are with me the last few days know that. But the reason we looked at that is because that's what these studies were studying, right? They were studying whether the effect was statistically significant. And that is a huge effect. When you think about it, most clinical effects of drugs are not 30%, right? They're very, very tiny. So this is a big effect. And there was no difference in risk of bias among these different studies. I'm going to come back to that a couple of times, but I think it's really important because what it means is that our risk of bias tools aren't actually capturing this funding bias, as it's now called. So this is a study that Nick Chartres conducted, and it's another way to look at the results of research. So here we were looking at whether there was a difference in effect size in a certain nutrition topic. So these were studies that looked at whether consuming dairy decreased cardiovascular disease. That was the hypothesis of these studies. And so we looked to see whether there were dairy industry sponsored studies differed in effect size from the non-dairy industry sponsored studies. So this study is like one of those lines on the previous meta-analysis I showed you. This is looking at studies. So we had 21 primary studies, and we looked at different study designs, and we looked at this multiple ways. But for this one, I want to illustrate the effect size point. And what you'll see up there is the industry-sponsored studies. There weren't that many, but they're at the top there. And they have a larger effect size than the non-industry sponsored studies, which are shown in the lower dot there. So that's what we found, a difference in effect size. And again, no difference in the risk of bias among these individual studies. So another way, as I said, the Cochrane Handbook no longer considers inference in their definition of bias, but we actually have looked at that. And I must say, everybody looks at that. So why am I showing you this ancient study? I'm showing you this study because I think it was, it was interesting for a lot of reasons. The reason, it was actually one of the first studies that looked at an association of funding with conclusions. And the first drug study I know of that did that was in 1994 by Davidson. And I know there's some in occupational health dating back to the 30s and 40s. Actually, I really want to do a scoping review on this to actually map it all out, if anybody wants to join me in that. But anyway, we did this one because it was a point in time where there were more reviews on the effects of secondhand smoke than original studies. And that just seemed really weird to me. Like, why were there so many reviews compared to original research studies? Well, that's because a lot of them were being cranked out by the tobacco industry and being presented directly to policymakers in regulatory proceedings. So they were having a huge policy influence. And so we looked at these reviews on the health effects of secondhand smoke. And I think this is the first study that tried to control for other factors. We looked at whether the outcomes of the reviews differed in terms of the quality of the review using some rating scheme, whether the paper was peer reviewed or not. I wouldn't look at that now, but anyway, we looked at that then. the topic, because, there could be a health effect on some health outcomes, but not others, and the year of publication, because you would think that a review might change its results over time. So this is a very crude analysis compared to what we did later and what we do now. But basically what this found was that if the review was funded by the tobacco industry, it was about 90 times more likely to say that secondhand smoke was not harmful. Again, that's a pretty big effect estimate. And that was controlling for all these other things, right? Quality, year of publication, et cetera, et cetera. So there have been hundreds of studies now looking at the association of commercial funding with conclusions. And as I said, I'd actually like to count these up if anybody wants to join me in this. So basically, I hope this gives you an idea how critical meta research has been to this field to actually help us figure out whether a bias exists and to somewhat get a handle on how big it might be. And what this meta research has shown to us, it's actually, there's an encyclopedia of bias, and this is called funding bias. The funding bias, again, includes funding for the study and funding for the researcher, is that their corporate sponsorship is associated with conclusions of studies that favor the sponsor, results that are statistically significant in favor of the sponsor, and effect sizes that favor the sponsor. So again, depending on what product you're looking at, it may be a decrease in harm or an increase in efficacy. But we have hundreds and hundreds of studies now, and meta research and meta researchers have been critical to building this evidence base. But meta research can only take us so far. It gives us an observation, right? But it doesn't tell us, how does this happen? Like, how does this happen? And so that's what I want to fill in now, this additional piece of the puzzle. A bias exists. How does it happen? So I always conceptualize this as, I alluded to this before, a cycle of bias. So to do research, you have to have a question, you have to have a research agenda, then you devise a method for your project. Usually, nowadays we publish that as a protocol, hopefully. But then you have to follow the protocol, right? It has to be conducted according to a protocol, and then it has to be made public in some way or not. And then once it is, that then influences the research agenda again, and we have this cycle of research going. So we can introduce bias at any point in this cycle, right? That's when bias can occur. All right, but meta research can't tell us too much about what's happening here, so we use other methods to do this. People, including me, have used a lot of different methods. So one example is, for example, if you're looking at drugs or if you're looking at submissions to an agency that regulates chemicals, you can look at documents that are submitted to the regulatory agency, which actually will include a fuller study report than one that's published in the medical literature, for example. So you can do these comparisons. You could also nowadays look at published protocols, for example, and published data sets. Those used to not exist very readily before, and compare those to what actually gets published. You can interview researchers. We've done a lot of that about what's actually happening as they conduct their studies. And you can look at previously confidential industry documents. My first slide mentioned the Center to End Corporate Harm, which I'm one of the founders of at the University of California, San Francisco, along with Nick. And this center houses millions and millions of industry documents that are available to the public that are from different industries: pharmaceutical industry, tobacco industry, chemical industry, food industry. Any I'm missing, Nick? I think that's
fossil fuel.
Fossil fuels. Thank you. Fossil fuels. So, I mean, an incredible resource of documents that were obtained through litigation, basically, that help us address this question of how the bias occurs. So Alice Fabry tackled this question of influence of industry sponsorship on research agendas or research questions. And we first conducted a scoping review, and I was kind of interested to find that studies on influence on the research agenda had been conducted in the mining industry, the alcohol industry, chemical, a lot related to health interventions and tobacco. But those weren't the only fields. And sort of the upshot of the scoping review was that these industry agendas were not aligned with public health questions or prevention, or they were designed to distract from commercial products. And I'll give you an example of that. But I know the first thing when I say this, and there's industry folks in the audience, they're like, well, that's not a crime, right? Of course, we're going to do research on our products. Why would we do research on, the public's health generally? So it's true. It's not a crime, but that is driving what we see in the medical literature, right? It's going to skew the medical literature towards questions that support commercial interest and not public health interest. So Alice, in her work, she did several studies. This is just one where actually Coca-Cola publishes lists of research they fund globally in a couple of places. And Alice followed up all of these funded projects to see where they got published and what they said and what their topic was. And basically, in a nutshell, almost half of them focused on exercise or physical activity as a way to combat obesity. And about 12% of them focused on sugar and its relation to obesity. So this is an example, again, of driving the research agenda. So I'm a policymaker and I say, wow, what do I need to do to tackle obesity? And I find like half the literature says physical activity, and there's not much on sugar. That's going to influence the way I approach that question as a policymaker. We did the same thing years before with secondhand smoke. There was a coalition of tobacco companies that hid their involvement in a center to fund research on indoor air, and they had peer-reviewed projects and non-peer-reviewed projects. Interestingly, the non-peer-reviewed projects were actually on secondhand smoke, and after a couple of years, they stopped funding those, and they never published them because they didn't like the results. But their peer-reviewed literature was on basically anything else in indoor air that might affect your health. Carpet off-gassing, whether having a green plant in your room was good for you, that sort of thing. So again, and I worked with regulators in the US, they're like, wow, there's all this data on, indoor air contaminants. Why are we worried about secondhand smoke? Shouldn't we be worried about the paneling on our walls? So this distracting research is very, very important in driving the research agenda. What about the methods? Now, remember I said in those studies, those meta-research studies I cited, there was no difference in risk of bias between the industry-funded and the non-industry funded studies. So that means, and that uses a lot of different risk of bias tools in those studies, but that means those risk of bias tools are, what they're studying, they're saying it's the same. So basically they're saying if the study's randomized, they're randomized just as well if they're industry or not. If they're blinded, it's just as well. The outcome reporting is just as good. Things that you typically see in a risk of bias tool. Now, over 20, no, not that long ago, 10 years ago, I debated Jonathan Stern on this topic about why the Cochrane risk of bias tool should include funding source as a standard item. Interestingly, I debated him on this 2 years ago, and neither of us have budged an inch. So we are both exactly in the same place. So I continue to argue that the current risk of bias tools don't account for this bias, so we need to account for it somehow. Cochrane has taken an approach of developing an entirely separate tool called Tacit, which has pros and cons. I won't go into it now, but that's been Cochrane's approach. Folks in environmental health are actually much more attuned to this issue. So there's a lot of systematic reviews being done in environmental hazard assessment, and tools like the navigation guide actually include funding source and financial conflicts of interest as part of the risk of bias tool. So I think they're doing a lot better in environmental health in that regard. Okay, but even if the method's like great and it's perfect, what's going on behind the scenes, like, you know, with how the study's actually being conducted? So I'm sure you all have seen these. They weren't too prevalent years ago, but now they're very prevalent. These statements about sponsor involvement in the papers. Everybody seen these? They almost always say the sponsor's not involved, right? They almost always say that. And, you know, a lot of journals instituted these statements because there was concern about bias in industry-funded studies. And it's really hard to figure out, you know, unless you looking at the whole protocol and how it was implemented, you know, what was happening. So this is an area where we actually interviewed researchers of clinical trials who had those statements in their papers. So these were 200 industry-funded trials of drugs that stated that the sponsor was not involved in the, and Christine Rasmussen was first author on this paper, that stated the sponsor was not involved. And so when we asked them preset questions, I mean, I was like so shocked by this, I couldn't believe it. 92% of them said that the sponsor was involved in the design of the study. 73% said the sponsor was involved in the data analysis, and 87% said the sponsor was involved in the reporting. Now, it might not have been very involved, but anyway, this just really floored me. And then we had like places where authors could write things in our survey. And 80 authors wrote something about who had the final say in the paper. And only 33% of those 80 said that the academic author had the final say. So, you know, this gives me pause. And this is only done with drug studies. I think, you know, we can't generalize to everything, but it was very interesting that this is what people said. Okay, but then we get, so there might be things going on, and it's actually very, very hard to study and very hard to capture, right? What's actually going on with the conduct of the study. And then there's whether the study gets published or not. One of my mentors who died recently, Drummond Rennie, you know, he always said research doesn't exist until it's published. And I think that was like such an important statement because like it was that cycle of research or clinical practice or policy for that matter. Oops, I hope that goes away because it's actually, okay. All right, so this is an area where we have actually really relied on analyses of internal industry documents to tell us what's happening. Now, all of you meta researchers know that we can conduct statistical estimates of publication bias. And good, you know, good evidence synthesis always does that. So you can get a statistical estimate of publication bias, and we used to do that in our, well, actually, we still do that in our studies. But like, I still wondered, like, well, how does that happen, right? And so this is an industry document. This is about a drug called gabapentin. And basically, I'm showing this because we did a lot of work around this drug. And this document, which is from a written by a drug company lawyer, says the results of this exploratory trial in neuropathic pain, if positive, and by that, I hate to say they mean statistically significant, will be publicized in medical congresses and published. And I have to say, the first time I saw that, it just blew me away because we had these statistical estimates, but here was an a priori plan, right? Before the study was done to say if it's positive, we'll publish it. And in this case, this trial will not be published. And that's because that trial did not have a statistically significant result showing efficacy of the drug. So this was an a priori plan before all these studies were done about whether they would be published or not. So this, I was fortunate to collaborate on this study with Kay Dickerson, and she not only had access to these internal industry documents, but additional documents and trial reports through a court case she was involved in. So basically on the bottom, these are all the gabapentin trials in question that were done for this particular indication, right? So each line there is a trial, and we see the p-values. And again, this is how people study this. So that's why, and this is how they show up in court. They're talking about p-values. I'm not a big fan, but anyway, at the top, we have the higher statistically non-significant p-values, and at the bottom, we have the lower p-values. So for these trials, you'll see that they weren't published at all. So the trials over here weren't published at all. And what do they have? Big p-values, right? So statistically non-significant, they weren't published. These trials here, you'll see some were published and some weren't, the outcomes. And so the ones that were published tended to be, the ones that, were not published are up at the top there, and those are the statistically non-significant ones. And so that was when there was multiple outcomes in a trial. The significant one would be published and the non-significant one would not. And then this one here gets a little more complicated because there's 2 dots for each line. And so that meant that there was multiple analyses for the same outcome. And so what we see here is that when there were multiple analyses for the same outcome, the statistically significant one tended to get published. This line here illustrates it very well, where the statistically significant analysis in blue is published and the statistically not significant analysis in red is not published. So this took a lot of poring over to figure out what the outcomes even were, how many there were, how they actually appeared in the medical literature, and what multiple analyses were done of the same outcome. But the gist is, out of 19 trials, and it's summarized in the corner there, 7 were not published at all, which I call publication bias. 4 had selective outcome publication, so some outcomes were published and some weren't, and 11 had selective analysis. And, I'm talking about drugs a lot, and I really don't have time to go through all the evidence on this, but I just really want to make the point, it's not just drugs, it's not just tobacco, it's not just food. Let's switch to a different topic. Let's look at PFAS or PFOS. So these are chemicals. I know these are a hot topic in Australia right now. These are chemicals that are found in flame retardants, paints, a lot of places. They last forever. They stay in your body forever, basically. They have a lot of fluorine in them. So we did one of these, this was led by Nadia Geber, an analysis of, again, documents from 3M and DuPont that reside at the University of California Library. And what this shows is a timeline of publication of research that was done by industry or not done by industry. And just if you, so basically everything in orange was internal research done by industry. And then everything in blue was independent research on the same topic done by others. And if you just focus on line C there, which is reproductive health outcomes, what you'll see is that the industry had evidence on reproductive health outcomes back in the 1980s and 90s. And the first publications on this in the independent literature, and that came out, for everyone to see, were in 2014, right? So a huge delay there. And interestingly, some of the earliest studies looking at funding bias were done in the area of occupational health, right? So if you look at vinyl chloride, asbestos, research on that, and this was often showing that studies conducted or funded in-house by industry, never saw the light of day until eventually independent researchers started showing the same thing. Then it might come out. So this is, again, I don't have time to go over all of this, but it happens across industries, these practices. It's the practices of the industries, not the products. So why does this happen? This is like the last part of the puzzle. And, you know, I cannot dare speak for tobacco or Coca-Cola or any of those companies that I've written about. So I can't really tell you why, but I can actually give you, again, some insight, which comes primarily from internal documents. This is actually, I think, one of the most famous quotes. I wrote a book called The Cigarette Papers, which looked at a lot of the industry documents from tobacco companies. And this was from the Tobacco Institute. And they're applauding themselves. As an industry, we seem to have done very well in turning out scientific information, which is true. So that's what they were doing. They were turning out the science. But they thought they were inept at getting their story across to the news media and the public. So they really ramped up their campaign, not only to do research, but to get it out and influence policy. And so that's one reason this research is done, right? It is done to get it directly in the hands of the policymakers. Now, this is Nigel Farage, and, you know, I'm sure I could get quotes from my own administration, but I might not get back in the country. So I apologize. I'm doing this about Britain. And can you imagine that somebody in 2017, 2016 is saying, I think the doctors have got it wrong on smoking, right? You know, I mean, it's pretty stunning. And this was on the heels of a World Health Organization report that had just come out showing more harms from tobacco. The World Health Organization puts these out periodically. And, you know, WHO was attacked, a club of clever, you know, people, just ignore them. You know, so it's amazing. These messages in this research just permeates the political environment. And if you do look at the reports on the Make America Healthy Again agenda, I mean, actually, my work is cited in there. It's miscited because it's written by AI and it's misquoted. But, you know, there's all sorts of research from industry that surfaces. Another reason that corporate interest fund research is in order to criticize independent research that's out there. The tobacco industry has created entire studies to refute a single study, and there's a history of that. This is an example. I wrote this up with Adrian Traeger of research on spinal cord stimulation. So there's a lot of evidence that spinal cord stimulation, and for example, there's 2 systematic reviews independently conducted of industry, additional key studies that show that this is not effective in relieving pain and that it may have some harm. Despite this evidence, it is far outweighed by the criticism that is being published of this evidence. And so this is a way that corporate interests produce research to control the discourse. So there's 15 out of 18 letters criticizing these studies were funded by someone with ties, the device industry that makes this device. The credibility of the scientists were attacked, you know, so things were said like they were incompetent or I can't remember the other uncomplimentary words, but, you know, things you would not say professionally. And also they tend to focus on just one part of the study, the actual setting that was used for the stimulation, and not actually focus on the fact that they were trials or that they were systematic reviews that were well done. So this is one reason that corporate interests produce research to refute independent studies. And, you know, as meta researchers, we have to be careful because industry also funds a lot of research on methods. So, for example, the tobacco industry has funded a lot of research on misclassification bias. And statisticians will say, well, I'm just a statistician, you know, that's not a bias. But, you know, that's fine. But those studies on misclassification bias are then used to refute studies that are submitted in government regulatory proceedings. All right. They're used for marketing. This is a document that shows a budget in yellow. That's the biggest number on how education and publications are going to be used for emerging unapproved uses. So you're not supposed to market a drug for an unapproved use, but you can educate people about it and you can do studies about it. And so this was actually the largest part of their marketing budget, was to do that. This is for gabapentin. I like to stick with my theme here. And this marketing strategy also had a publication strategy. And so that's it, publishing the research and doing the research is part of the marketing strategy. And this is a quote from a document: to use the research not as a means to gain FDA approval, but to disseminate as widely as possible through the literature. That was the whole point, not to gain new knowledge, but to market the drug. And then this is back to PFAS, and this is blurry. Don't read it because it has a lot of really offensive language, but this is the kind of thing lawyers say, which is incredible. But this just actually justifies, was an attempt to justify why they started publishing data on PFAS. Better late than never, right? So if you're going to get caught in litigation, then you want to get clean, right? You want to try to say, oh, I did get that information out there. So deny and delay, that is a big part of the strategy. So just to sum up, why influence the evidence? The goal is to increase profits. It's that simple. And that is done through marketing, litigation to protect against litigation of their products, and to influence regulation. So this is my last slide, Barbara, because at this point you're all like, oh my God, what's a scientist to do? And it's tough, but I think there's a lot of ways to break this cycle.
Oh, yeah.
And we can discuss more. One is public prioritization of research. Note, I say public and not government. We can use citizen juries. They do this in Canada. Anyway, we need to recognize that industry funding and conflicts of interest are a source of bias and account for it. A colleague of mine said, my God, you've been doing this for 30 years. Aren't you depressed? Nothing changes. And I said, well, no, actually, really, I think a lot has changed. A lot has improved. But, we still have to do this. A lot of people don't recognize it. We need open data for all. I have another talk on influence of industry on science policy. And a lot of times it's one-sided. They want open data for academic researchers, but they don't want open data for industry researchers. Unless we have open data across the board, we can't know what's the difference between industry funded and not. We need to eliminate it at a structural level. A lot of our policy focuses on individual researchers. That's not good enough. We need to really change it at a level. So like accept tobacco industry funded research. Many research organizations do not accept funding from organizations that produce products they study. So that's a good way to eliminate it structurally. We need to rethink funding and COI disclosures. They're still not good enough. We have a workshop coming up on that, or a hackathon coming up on that. And we do need to have independent publishers of research. We have many, but we also have many industry-sponsored journals which really facilitate this process. So thank you very much for your. I can take it down.
Okay, well, thank you very much. And we'll just open to questions and comments.
Thank you, Lisa, for a wonderful talk. I'm wondering whether you've seen in your research whether the sort of drug company playbook changes according to the drug type. So I'm thinking about like chemotherapy for cancer patients versus something that where the patient might have a more discretionary role in whether they take that drug or not.
Yeah, that's a good question. The general practices that I've been talking about, I think have been the same across the board. There might be additional strategies, like where the patient has more control over what they're taking. You'll see the research is winding up more in like direct-to-consumer marketing, for example, or in a place where the patient can have influence, whereas it might be more directed at doctors, for example, in the chemotherapy area or an area where patients have less influence. But kind of the mechanisms to influence the research that I've seen from those meta-research studies have been the same. Oh, sorry. I think, did everybody hear that? I think it's pretty loud.
About your shocking slide with the authors admitting how the industry affected or the sponsor affected their different phases of the research. I didn't get whether did those same authors all say that in the published article that the sponsor didn't have any influence on the research, and was this an anonymous survey? So was there discrepancy there, and why?
We selected articles that had drug industry funding, but we didn't know who was responding to the actual statement.
But it's so unlikely. There's so few that actually say that the sponsor influenced them. You think they were all lying in the article almost?
Well, I think maybe people aren't thinking about those statements, that they might be just doing them as a gut reaction at, when they're submitting their article and just saying there was no influence. I don't know. I mean, it's interesting because I've worked with editors, in Cochrane, where we have to ask the authors, and Jenny, you know a lot more about this, to actually make certain statements, about their role or the role of the sponsor. And they're doing it when they're submitting their paper, and they just kind of go, yeah, so maybe it's not, absolutely deliberate, I'm lying, but, they just say, oh, sure, no, the sponsor didn't have any role. But then when they think about it later, they gave us a different answer.
Thanks so much, Lisa. That was great. I just was wondering your perspectives on consumer advocacy groups who, are kind of pushing a certain agenda in one way or another and can be backed by people with major financial or conflicts of interest.
Yeah, well, Barbara's really the expert on that. She should answer that. But again, the focus here was research, but we do know, particularly through the Australian databases, which have actually given us information on pharmaceutical industry funding of consumer groups, that pharmaceutical companies are big sponsors of consumers groups. And there's been some limited work, I think, and Barbie, you feel free to answer, but showing that the messages of the industry funded consumer groups align with industry messages. I haven't looked, for example, on how they're using or citing research.
Hello, thanks. Sorry, just here.
Oh, yeah, sorry.
Thanks for an excellent talk, Lisa. My question's about your last point there, independent publishers of research. Should we be boycotting for-profit publishers of research and prioritizing independent publishers of research when we publish our articles?
Yeah, there I'm really talking about independent from the kind of commercial companies I'm studying here. So there are a lot of for-profit publishers around, but there are also journals like, I think the Journal of Clinical Pharmacology. There's a couple of other journals where like the editors are completely industry funded, and where the journal might be also completely sponsored by industry. So those were the ones I was talking about there. And there's actually, sorry, I have to go look it up in my work, but there's actually a journal in pharmacology, John, maybe you know it, but they publish only review articles. And it's an industry sponsored journal, pharmaceutical industry sponsored journal. And basically it's just an outlet to keep publishing these review articles. So that's what I meant.
Yeah.
So we just have a question from online, an online participant. This is from Akihiko Ozaki. So thank you for your lecture. I have one question. When we talk about the commercial determinants of health, the alcohol, tobacco, and the sugar industries are often seen as the representative examples. How do you position the pharmaceutical and medical device industries within this framework?
Oh, I think they're totally within that framework. So the question was about, usually you think about alcohol, tobacco, and what was the other one? Food, sugar, in terms of commercial determinants of health. But as I was trying to make the point, I think it's really about the practices of these industries that promote or inhibit health. And so I would put all those other pharmaceutical and device companies, I would put right under there. Because to me, it's not about the product. a company might make a product that is actually good for you in certain circumstances, but they could still have the same practices that tobacco companies are using to make their product really harmful to people. Drugs. We have overuse of drugs. We have harmful drugs, you know, so it's not the product, it's the practice.
So I'm curious, you mentioned those debates you had with Jonathan Stern about
Yes,
that
yeah.
risk bias tool. I'm wondering what was his argument for not including funding in the tool?
The gist of it is that the risk of bias tool already accounts for selective reporting bias, and that is the main reason, which I argue is not the case. And then the other, and he actually in our last debate 2 years ago, he moved a little on this, is there was actually less evidence or less of these meta research studies when we originally did the debate. Now there's more.
Well, thanks so much, Lisa. That was an incredible talk. I'm in the medical research field, so it's really insightful, specifically respiratory. I was wondering, how do you identify the journals that are industry funded? Is there a database? Or?
No, there's no database, and I'll have to go back. Maybe they're all gone now, but actually, this comes through investigating the journal. So. Actually looking, for example, at financial disclosures from editors of journals. Like a lot of journals now, actually, the editors make financial disclosures. They used to not do that. And so you would have to actually dig to find out like what they were disclosing in other settings, for example. And so it took investigation of a journal. Simon Chapman wrote about one journal, which his name is escaping me. He has a really good case study of one of those journals.
So I think we've got one question. Do you still have a question or not? Okay, John, you have a question. I think that's going to be our last question.
There was one over there.
Okay, one more after.
I think it'd be more subtle than that. So the early psychosis journal, the early intervention for psychosis journal, is an example of a journal that was established with drug company sponsorship. And then when it's got sufficient runs on the board, a conventional medical publisher will take it over. And so it can actually be quite difficult to work out whether it's a commercial entity or whether it's more safe.
Yeah, that's a great example. I forgot about that because some of them just go out of business and some of them, right, get taken over and legitimized to an extent. But it does require investigation. Yeah.
Thank you. It was a really great talk. And I was wondering if you think that IT companies or like AI more specifically is also should be seen in the same light of a commercial entity influencing the health research agenda.
Yeah. So the question is about like AI companies or, you know, IT companies. And I'm very, very skeptical of all corporate interests, as you all might imagine. But, you know, to me, the link is really what is the product they're selling, right? And how does that product affect health? So all the industries I'm talking about directly affect health. You know, they're things you consume, they're, you know, drugs you take, they're foods you eat, et cetera. And so AI, for example, there might be decision models that could be biased and flawed by AI that can affect your health. And, you know, if the bias is in a way that it creates more profit for the AI company, that would be a conflict of interest. But it's gonna, you know, it's not as straightforward to study as all of these companies which have products which actually directly affect people's health.
Yeah. So I'm going to just say thank you on that note, that I think we can continue the conversation at the morning tea, but thank you very much. I think also for setting the scene of combining those themes of research integrity and commercial influences. So hopefully that'll be lots of food for thought during the conference.